Good afternoon once again, our wonderful viewers. Nice coming our way this afternoon. Forgive me, I've lost my voice. I'm having a little bit of flu, but we still have to come your way because Customs Baby Ghana deal with experts and trained midwife who are equipped, who are learned to bring you expert advice on maternal and child health. We are adding our little voice to make sure when the woman goes to the labor ward, she comes out with her child or her children. The partner is able to help from the journey from day one all the way to 9 months. Then after, that is the prepurium, that is postpartum, the partner and the mother and the baby and the grannies and the aunties and uncles will all come on board to make sure that baby thrive, baby grow, and baby actually grows in a very healthy and a loving environment. So Customs Baby Ghana every time thinks about mothers globally and to be precise in Ghana so that you get the needed one or two tidbits so that you can walk through your journey in maternal and child health. This afternoon, we are here to talk about how to navigate smoothly through mood swings in pregnancy. Somebody will say it's a normal thing. It's not, because some mood swings can lead to postpartum depression. And postpartum depression, if not well taken care of, can lead to actually depression itself. And we can lose the mother, which means our baby wouldn't get sufficient or enough breast milk, or baby wouldn't get breast milk at all. And we don't want that because we know already the importance of breastfeeding and we know what goes into breastfeeding, because the mother needs to be of sound mind, of sound body, and a healthy body also. And breastfeeding can be successful. You need a baby, you need the father, and you need the mother, and you need the breast and the milk for the baby to thrive. So that's why your midwife expert, Midwife Ruby, always comes to your corner and have that chit chat with you. So mood swings. We are here to talk about mood swings in our own way of understanding. We will never ever bombard our viewers with big jargon so that it will be like our viewers wouldn't get what we are saying. But we always want to come your way with simple terminologies so that you can understand the concept behind everything that we are teaching you when we come our way. But before we start, we'll talk about our baby powder. Yes, our baby powder. Yeah. So we have our pink, which is our soft and smooth, and our blue, which is our mild and gentle. So mild and gentle, which is the blue one, is for sensitive skin, and the soft and smooth is for all skin types. It's for all skin types. And I always say, just always go in for the mild and gentle for the first 3 months of the child's life, because you don't know the child's skin type, whether it's a normal skin or it's a sensitive skin. While the child is growing and the child is gaining weight, the child is shedding weight, and you know the skin type your child brought, that's when you can swap and go in for the pink one. That is the smooth and the smooth and soft, especially when the weather is very hot and the heat rashes start. Don't forget to use our powder. Don't forget. Any challenge you have, just go in for PZ Customs Baby Powder. And we should always apply only the powder. We shouldn't apply the gel or the baby oil with the powder combination. No, choose one. If it's the powder at night, it's powder at night. If it's the petroleum jelly, fine. But today we are here to talk about our powder. So let's go all out to all various mother care shops and supermarkets, and let's get our powder and use it on our baby. Thank you. So to our today's topic, we are here to talk about mood swings, how to navigate through mood swings. So mood swings is a common experience that every pregnant woman goes through. First trimester and third trimester, especially latter part of third trimester. Before we end the topic, we understand why latter part of third trimester is part. Now, it's a normal experience every woman goes through because there's hormonal fluctuation between the estrogen and the progesterone. They really come into play when you are pregnant. Those are the two main hormones which come into play, especially when progesterone needs to go up and estrogen needs to come down. And estrogen doesn't want to understand, he or she wants to come down because there's a baby growing. When the baby is growing, automatically there is fluctuation and the hormones needs to be balanced so that baby can thrive. And in the first trimester, you experience all this. And my camera woman, please put my first slide on the screen for me so that I can show my viewers and let's elaborate on it. Thank you very much. So when on our screen, these are tips, but before we talk about these tips, we'll just talk about the mood swing itself. Then we'll concentrate on the tips because each one goes with the tips. That's why I want my viewers to see the tips and we go on. So mood swings or changes in emotional states are common experience during pregnancy, like I said, and they are often attributed to hormonal fluctuations, fatigue, and stress. Yes. So fatigue and stress. One, so you look at our first tip, that is, don't feel guilty for your mood changes. You shouldn't feel guilty at all. That is the first tip. When you experience those fluctuations, when you feel tired, when you feel stressed out, and you realize you are acting overboard, somebody tells you, why are you acting overboard? Which is even not a good expression to use on a pregnant woman. You shouldn't feel guilty at all when your mood changes. These changes can manifest in increased sensitivity. Yes, you can be so sensitive to things that people think are not important, but to you it is important. Then also, you become so irritable. Things that it shouldn't make you annoyed, you are annoyed. You become so anxious about the uncertainty. I'm pregnant. I've heard so many things that goes into pregnancy. What will happen to me? What will happen to my baby, especially with first months? They don't even know. Aside that, also, you become sad. Yes, there's sadness. So all these changes that I'm saying, you shouldn't feel guilty at all about it because the sadness is normal. For you to even feel sad, this morning I don't want to wake up, this morning I don't want to eat, I don't have the appetite, I'm vomiting throughout. Once I was not pregnant, I was not vomiting. Why am I vomiting now? All these things can happen in first trimester and latter part of third trimester. Now let's delve into hormonal changes a little bit. Still our screen, and let's still slide on the screen. Pregnancy hormones, especially estrogen and progesterone, are significantly have an impact on the brain chemistry, affecting the mood and also regulating us as pregnant women. And you know, everything starts with the brain. That's why in my intro I said when mood swings are not taken care of, we can get postpartum depression. And you know, breastfeeding starts with the brain. And you have to communicate as the pregnant woman. You have to communicate with your partner. That goes to our next photo that we are seeing. All this changing that you are experiencing, you know, you are not that kind of person who easily gets annoyed. You don't cry, you are not worried, you are not anxious. By immediately you got pregnant, you have seen these changes. Communicate with your partner. Let your partner understand what is happening to you. I've realized this is happening to me. Why I need help. That's why your midwife is there. That's why in your antenatal card, your midwife number is there and the name of your midwife, that you can easily communicate with your midwife. Even if you can't, by communicating with your partner will also call your midwife and let your midwife know what is actually happening to you. Then the necessary measures will be taken into place. Then fatigue. Still don't communicate with your partner. It's you get tired, especially first trimester. Every little thing you do, you feel tired. Every little thing that you do, you feel so tired that you don't even want to do anything. So physically, depends on the pregnancy, include sleep disturbance, nausea can also contribute to fatigue. So this is when your partner still comes into place. When you let him or he be aware that this is what is happening to me. I wake up, I'll vomit early in the morning. I can't sleep. They said I should lie on my left side. I lie on my left side. I'm so tired. I feel pain at my left side. I don't even know what to do to myself. When your wife or your partner tells you that this is what I'm going through, you need to understand her, because coping with mood swings in pregnancy, it's a lot. It depends on both parties. One needs to understand the other, irrespective where the problem is coming from. Then stress also is also a factor. Physical, emotional, and financial stresses associated with pregnancy can trigger mood swing. Physical, emotional, and financial. So physically, your partner needs to be there. Emotionally, he needs to give you the support that you need. He needs to understand you. He needs to walk with you through the journey from day one all the way to 9 months. Then financially, when it's time for you to go for antenatal, when you need to eat the healthy 4-star diet, your partner should be there to provide financially for your antenatal clothing, for the child's clothing, things that need to be bought before the child needs to appear. Your medication, your prenatal medications, escorting you also, and making transportation available when labor sets in if you don't have a car. All these things are also contributing factors that can trigger stress in pregnancy. So 4-star diet is important. Can I have my slide back, please? 4-star diet is so important. Thank you. 4-star diet is so important. Communicating with your partner is important. You shouldn't feel guilty for your mood changes. Then also, we are also saying that anxiety and worry Concerns about the baby's health, financial stability, and transition to parenthood can also contribute to mood fluctuations. So it's not everybody who has accepted that, oh, I'm pregnant, I'm okay. Everybody, especially when you're a first time mom, if you have to be that lady who was not pregnant, you are enjoying your husband is enjoying you. Now you need to transcend to be a mother and a father, which you've not been that before. Is also another huge challenge for all of us, including I have experienced it before. Everybody around me I know has also experienced it before, because at the end of the day, you need both parties to work each other. Now, we are managing our mood swings, still on the tips to cope with our mood swings. So you could see low impact exercise. Yes, when the you realize your first trimester, you are pregnant, low exercise, you can just lie on your bed and just stretch. When you look on the screen, you see what my animated cartoon is doing. If you can't, you can just throw, can I have the camera back on me and let me do that exercise and show it to my mother? My camera woman today is a woman who is my camera woman. So can I have myself back? Thank you. So if this is the arm together, when you sit, you can just raise the arm up and bring it down. Raise it up and bring it down. Raise it up and bring it down. You can move it to the side, move it to the side, move it to the side. Then you bring it back onto your lap. I'm sitting down. So at the end of the day, you can see that we go up, we go up, we go up, then we move it to the side, we move it to the side, we move it to the side, we move it to the side. Then we bring it down back to our lap. We do it, we relax for 5 minutes, then we do it all over again. So first trimester, you don't need any strenuous exercise. You don't need to be going for jogging, be lifting. No, you don't need all those things. All you need is a smooth, less stress exercise. That's what you need, so that you can have that relaxation from your head all the way to your toe. So these exercises helps a lot. It relaxes your mind, it relaxes your body. At the same time, also our deep breathing exercise is good. You breathe so that there will be expansion of the lungs, which will make you, the mother, comfortable. Somebody will say, how do we do it? Yes, I'm going to demonstrate to you. So you take in deep breath. You do it for about a minute, you relax. You do it for about a minute, you relax. So that is your deep breathing exercise. So these two exercises I always recommend for first trimester. Then somebody will say, okay, dance. Yeah, definitely you can dance. But it's not vigorous dancing, no. Because first trimester, that is when baby is embedding. That is when baby is forming. All the vital organs are forming. So you don't need things that are so energetic and rapid. No. Otherwise, you can even abort the baby and you can lose your pregnancy. So you need things that are light, things that are less energetic, things that at the end of the day to be sufficient for you and your baby or your babies. It's very, very important, and it's very, very crucial also. Can I have my slide back? Thank you. All right. Please bring your questions. We are here today. We will really answer lots of questions, lots of it, because these topics, people Barely. Wow. Okay, so let me take this first question. Elena, thank you so much for asking the question. How can I differentiate between a normal mood swing and a more serious condition like prenatal depression? Thank you. All right, I'm going to answer your questions and we are going to go back to art. Please, can you take the um, slide off? Yes. Can we take the slide off and let me ask? Please, can you put her question under? Thank you very much. So, Ethel, now, for our normal mood swing, yeah, thank you so much. For our normal mood swing, like I said, you become irritable, you become stressed up. At the same time, also, there's fatigue. Now, with our depression, forgetfulness is not part of depression. Depression, you lose sight and focus of yourself. You don't even know you have a baby. You don't even know you have even given birth. At the same time, even you don't know even you are pregnant. You forget about everybody, including even your own partner. That is how depression is. You get so sunk, or you get like the brain, that part of the brain that will help you to identify everything around you shuts down totally. And you start getting suicidal thoughts. Everything around you scares you. You think everybody is somebody who wants to harm you. But when it comes to mood swings, you know this is your partner and you are lashing out your anger or your anxiety upon the person. Little thing, you get annoyed, especially when you don't have a good sleep and you wake up. Maybe you vomited throughout. Maybe you started vomiting around 3 a.m. all the way to 6. You didn't get enough sleep. And you realize your partner is just sleeping and snoring. And your partner wants you to wake up and prepare breakfast. You can just imagine what will happen that morning. It's not going to be an easy thing at all because you want him to understand. That's why we are saying when it starts and you feel that what is happening to you, that's not you. One, you are not that person who easily gets annoyed. You are not that person who complains about everything. You are not that person who vomits, who feels nauseated. You are not that person who complains about everything about her that she sees. Immediately you see those things in your first trimester. That's why we say communicate with your partner. But and postpartum depression also, there's a difference between mood swing and a serious condition like postpartum depression than depression. The postpartum depression, you feel you are all alone, or prenatal depression, because you are not getting any help. You feel tired, you breastfeed the baby, you are thinking, what will I eat? My partner is not even providing, he doesn't care, he goes out, he doesn't come home early. I'm all alone. Now, immediately you start thinking that way. You are not absent-minded. You know your environment. You know you have a baby. You know you have delivered. You know your partner is not showing the financial support, the emotional support, and the physical support that you're expecting. So at the end of the day, you get sunk in sorrow. You think a lot, and that will let the breastfeeding calm down. It will be decreasing gradually. Then when care is not taken, when you are not communicating, when you are talking to your partner and he's not listening, you have a mother, you have a father, you have siblings, you have a very good friend. Talk to the person. You need to communicate because mood swing starts from latter part of third trimester, can graduate into postpartum or prenatal depression, and that one too can graduate into depression. So it's a chain, and we need to break it. You break it at mood swings. We don't even want to experience prenatal depression. That's why communication is so key. So, Ethel, I hope I've answered your question. And I hope if you want more clarification, just come back. I'm going to clarify more. But in a simple language, like I said, we don't ever want to burden our viewers with huge jargons. We don't want that. We don't want that at all. Because at the end of the day, we want our viewers to understand it so plain that when they are even sharing it with friends, that they can also explain like the way I have explained to them. So normal mood swings, it starts from first trimester to latter part of third trimester. Prenatal depression starts after birth. Immediately the baby comes out, prenatal depression can start. It's no more mood swing again. It can be prenatal depression. Then after 6 weeks, if still care is not taken, prenatal depression or postpartum depression can move to depression. So that is the difference. Mood swings are just in first trimester and latter part of third trimester. Prenatal depression can start from the one the baby, they say push, baby comes out and you hear the cry. The mother can start experiencing the prenatal depression, especially when she's a first time mom, because she's actually graduating from a single girl with beautiful curves, with the breast which was standing, now with someone who was having a flat tummy. Now she's going to experience a little bit flabby tummy. The breast will be coming down. At the same time, also, she's going to gain weight. She needs to prepare her mind. She needs to prepare her body. She needs to prepare her soul for that. And that's when the partner comes in. The partner needs to even come in from antenatal so that that support will be there. The support base, as a pregnant woman, needs the support base of everybody, whether the husband's mother, the lady's mother, the siblings from both sides, friends, and everybody needs to play a role so that she can navigate gradually into motherhood. And the father will also navigate gradually into fatherhood. Then both of them, the parenthood will be very strong because they know they have the support base of everybody. Ethel, I hope I've answered your questions. Let's continue to bring our questions. Oh, you are welcome, my dear. Thank you. And 1,000 kisses to you too. Oh, okay. Hi, Vera. I hope we are all enjoying. Can I have my slide? Oh, hi, Marisa. Hi to all my viewers. Thank you for joining me. Thank you. Can I have my slide back and let's finish? Thank you so much. Thank you for joining. This is what we love to see our viewers taking part in everything that we do. Then to our next exercise, those who know how to do yoga, you can still do. It's a form of exercise. It's a form of exercise relaxing the mind and the body. So it's a form of meditating. So indirectly, when you are relaxing your mind, you are encouraging yourself, talking to yourself. You make yourself understand that at the end of the day, I am going to be a mother. This my child I'm carrying, or this my children I'm carrying, they depend on me. I have to be a strong mother. I have to be strong for the journey ahead. When the time is due, I have to push. I have to push. When the time is due and they say my babies are too big or my baby is too big, I need to go for cesarean section. I need to be ready and say to myself, I'm going to go in, come out with my baby still strong. I'm going to call my midwife when I have any questions or difficulty. I'm going to communicate with my partner if I have any challenges. Even if I don't have appetite to eat, I should always remember I need to eat for myself and my baby because I'm not alone. I need to take my prenatals on time. These are all part of things that you should be saying to yourself when you are doing your meditation, or you are starting your journey through meditation, or you are doing yoga. You should be taking your medication. You should be hydrating yourself often because you need it. Now, we are managing our mood swings. We need to prioritize our sleep. When you know that you don't sleep properly, and you know you sleep for 4 hours, 5 hours, please sleep early. The chit chat communication going on social media and all those things, when the sleep comes, please sleep. Then also let's learn to relax. Which are stresses, when the stresses are coming, when that day you are feeling for banku and tilapia or ampesi and abom, or you want to eat jollof rice with some salad, and your husband is saying today there's no money, there's some okra stew there already which you prepared the day before, and there's some banku there already, please manage it. You need to manage your stress, because it's not every day that there will be Christmas in your house. Yes, let's manage it. Sometimes we need to be understanding. Sometimes we have to just manage it. It's not everything that we have to cry. Then we should also communicate with our partners. Like I said, everything there should be communication. Everything there should be communicating. And you should seek for professional help. Like me, everybody watching me, those who know me very well. They know my journey. They know the schools I went. You need a professional in your life. You don't need anybody who is not a midwife, who is not your family doctor, who is not an obstetrician. You don't need anybody who doesn't know. You need people who know, who can actually help you to navigate through your mood swings, who will help you to answer the questions that you need to get answers for. Then also, you should maintain a healthy lifestyle. So our 4-star diet is important, our rest and sleep is important, our exercise is important, our hydration, a lot of fluids is important. And you can prepare your smoothie also and enjoy. Then we should learn to connect with others. Yes, make friends. I tell my mothers, when you come for antenatal and at the end of the day, someone sits beside you. Can my viewers see my face now? Good. Thank you very much. Yes, and someone sits beside you. Try and take the person's number, telephone number. Yes, you should have the person's telephone number so that when you get home, you can even call the person. It got to a time my mothers became friends. When she gets to antenatal and the other friend is not in, she will call, "Where are you?" And I'm telling you, this has saved a lot of mothers from dying, because I had the experience. A mother didn't come for antenatal. She was supposed to be coming every week. I said, anytime I say this, I feel so sad. It's not once, it's not twice. She was supposed to be in antenatal. She didn't come. And the one who always comes and she sits by her realized the friend was not in. So when after taking care of her, she came to me. She said, this woman has not been in. You've taken care of me. Normally, when you take care of me, she follows. I have a number. Let's call. We called. There was nobody picking the call. And then the phone just it was off. That was when I got scared. And I told her, do you know her house? She said, yes. And those who know Tema very well, she lives in Site 5. And I told her, let's go and look for her. And I got to the neighborhood. The neighborhood, almost everybody knows me in Comte 1 because of the job I do. I don't care to go down to the level of my patients, because it's because of them I am who I am today. And we went there, we knocked, nobody responded. Then one particular lady came. I said, strangely, for the past 3 days, nobody, I've not seen the door opening or closing. But there's a foul smell that comes out of her room. And I said, so you've not seen her coming out? That's when I got scared. And I told them, see, let's organize some people and let's see if we can break this door. And we broke the door. And the woman was just lifeless and dead. She died 3 days ago, a pregnant woman in their room. That's when we have to go to the police station. The husband was at the northern region. The husband is a driver. We had to call the husband. The husband came. The husband went to Temajino Hospital to go and just identify her wife with the unborn child, all gone. So everybody watching me, whether you are pregnant or you are not pregnant, when you go for antenatal, make friends. Irrespective, there will be somebody who will click with you. There will be one person who will be so close to you that you cannot do away with that person. Exchange numbers. Talk to each other. When you are coming for antenatal, call each other. I'm going, oh, let's go. Because normally we arrange the mothers. Those who are supposed to come for third trimester, they have their dates. Those who are supposed to come for second trimester, they come for their dates. They have their dates. Third trimester, they have their dates. It's everywhere, internationally. Even aside Ghana, you go to America, it's there. Australia is there. Canada is there. So that you should have that person you can call. Today, I have a midwife's antenatal visit. Do you also have? Okay, then we'll meet there. You get there before your friend, you call. Where have you reached now? I'm waiting for you even before I even put my card down and see the midwife. Let's be each other's keeper, because communication or looking for each other has saved a lot. Then one person was also saved. We went to the house. Lucky she was unconscious. We had to rush her to the Magina and we saved her. They did an emergency, yes. The baby is, I would say the lady. She's not even more a baby anymore. She's a lady now. And the mother is alive. And they are all doing well. So having contact with your other pregnant woman is very important, especially in your first trimester and latter part of third trimester. Now, somebody will say, why should I experience latter part in my third trimester? Mood swings. Yes, the unforeseen is there. You don't know what is going to happen. You've not pushed before, but they say you have to push. Like somebody who has constipated for 3 days, you have to push the baby out. You've done rehearsals in the house. You've gone for pregnancy school, antenatal clinics and all that. They've taught you to do deep breathing exercise. They've taught you how to push, but you are asking yourself question. There's reality and there is what is unreal. When that day comes, that anxiety will set in. Can I push? That are the questions you'll be asking. Hey, how does my baby look like? Even though if it's a 4D, 5D, 6D even scan, you still want to hold your baby. Hey, am I going to be a mother very soon? Am I going to, so me too, I'm also going to breastfeed. The latter part of your third trimester, these are the questions that you ask yourself. That changes your mood, especially if you know you were weighing 50 kg when you were not pregnant. Now you are pregnant, you are weighing about 70 kg, which means you've added 20 more kilograms. You don't understand why you've added 20 more kilograms. And moreover, you look at your waist is so small, and you are carrying more than one child in your belly, and they expect you to push the baby, so you expect to lie down and go for cesarean. Can I bear the pain? I've heard people are saying, when it's time for you to push, it's painful. That is the truth. The contractions is very painful. Everybody watching me, I'm not going to lie to you. It's really painful. But it's worth it, because the pain is what will urge you to push the baby out. When there is no pains, for instance, now if you are pregnant, you are watching, there's no pains. So why will you push? Nothing will push. There's no motivation. It's the pains that motivate you to push. And the journey is so easy when you have a supportive partner, you have a supportive midwife, and you have a good supportive fan base back home. That is your family and friends. Those around you encouraging you. You need all these things to navigate through mood swings. Now, estrogen and progesterone, they are two important hormones that play a very vital role as a woman. You can't do away without it. And you need the mood swings so that you can be a better mother and your partner can also be a better father. Without mood swings, you wouldn't enjoy pregnancy because that's when you have preference. That's when people listen to you. But we don't want to graduate to postpartum depression and depression. No. We only want to enjoy the mood swings, nothing more, nothing else. Can I have my second slide? Thank you. All right. So on your screen, if you can see, yes, I'm hoping, I don't know if my camera woman can zoom my picture a little bit. I don't know if she can, but if she can't, I'll read it aloud to my viewers. So how to overcome good swings. So if you don't want to experience the mood swings as early as your first trimester, things that you have to do. So you see, overcoming it, we just turn it. Just like the first slide that we saw, we just turn it. We have to practice relaxation technique. We have to get enough sleep, and we have to involve in physical activities, the exercise that I spoke about. Then we watch the diet that we take. So our diet should be 4-star diet, and we have to hydrate more by taking in a lot of fluids. Then you should have a good support base. Yes, there should be everybody there for you. Then also you need professional help. Without professional help, you can't survive. I'll continue to say, you need professional help. You need professional help. With all the professional helps, you need one. Your professional can be your midwife, it can be your doctor. They can help you to manage your high irritability. They can help you to get your. There are some people when they are mood swing, they only cry throughout because they need somebody to listen, understand them. If they are not getting anybody, what all they do is cry throughout. You don't. That professional also can help you if you're having panic attacks. Yes, some people, their mood swing is only panic attack, like they get scared. Nearly they get scared. In Ghana we say obobrim. The person is just sitting down and just get scared, and the person can't even breathe. Or if I didn't get the word right, obobrim, I don't know. I don't know if it's wrong, but panic attacks, when it happens, if you don't take care, the person cannot breathe. The person's eyes widens the eye and just stares at things because the person doesn't know what is actually happening to her. Then also your professional or your midwife will help you through the unnecessary anger, through the nausea, through the vomiting. And you don't even need pica also. Some people, pica, things that you are not supposed to eat when you are pregnant. For instance, shire, clay, and all those things. All those things are pica. You don't need it. You don't need all those things. So your midwife will guide you through all these things so that you can navigate and navigate well. Then also, pregnancy mood swings are various sets of negative emotions. They are negative emotions. Just always keep that. That is fear, anxiety, unexplained crying, and episodes of low esteem. That is mood swing. You feel, please can you take the screen off so that I can talk to my viewers? Thank you. My slide off, please. Thank you. So mood swing at the end of the day, you have low self-esteem. For instance, you know you are pregnant. Everybody know you to have figure 8. Coca-Cola, Fanta, beer bottle shape. Anyone makes you so special as a woman. But pregnancy makes you more special because you gain more by gaining weight. That doesn't mean you should have low self-esteem. No. You shouldn't look at the changes that you are experiencing and say, I don't look like who I was before. No. You shouldn't be anxious. Even our Bible, our Holy Quran says, be anxious for nothing. You shouldn't, because that makes you a woman and you're a creation and you carry the whole generation, a whole generation. Oh, when you are pregnant, it's a whole generation you are carrying. You are not carrying anything just like that. It's a whole generation. So you could see you are carrying a whole life. You don't need anxiety. You don't need the low self-esteem. You don't need to be crying because you are pregnant. You've not committed a crime. Thinking people will be pointing finger at you. Yes. I remember when I was pregnant with my first boy, somebody saw me and was like, ah, you're also pregnant. And I was like, what is wrong if I'm pregnant? Hey, you've also done some. I said, but it's a privilege for me to be a mother. And I'm happy I am. Don't think people will think you're a bad girl or you're a bad person when you are pregnant. No. That idea that we have as Ghanaians that when a woman is pregnant for the first time, she's a bad girl. She has done nothing wrong. She's bringing a whole generation into this world. You don't know the future president, the future first lady, the future who is coming to make sure the city will stabilize for the rest of till the world comes to an end. The person who is coming to give us new invention. You don't know who that woman is carrying. So we should even be grateful that someone is pregnant. Then also, we are saying that mood swings, we shouldn't feel shy to talk about it as pregnant women. In your first trimester, learn to communicate with your partner and with your midwife, especially in your third trimester. Communicate a lot with your partner and your midwife, especially because in the labor ward, you'll be there with your midwife and your partner, because we encourage the men to come to the labor ward also, so that that emotional support will be there. And you know, financial support too is there, because when you see the man, you know they will discharge you early, bills will be paid early, and you can go home and enjoy your husband and your baby or your babies. So that vim is there to push and push well. So all our partners also watching us, please, when we ask you to escort us to antenatal, follow us. To the labor ward, follow us. When we want you to call our midwife, please call our midwife for us, because mood swings can be managed, it can be stopped. It's not anything. One person just needs to be patient for the other and be that encourager, be that support, be that pillar, and let her understand this is normal. We are all going to walk through this journey safe and sound with no problem, and we are all going to be fine. When you explain this to your partner, I'm sure the woman will feel relaxed, because she needs the relaxation. And the morning vomit and the nausea she's experiencing when she's vomiting, we are not saying every day wake up and check on us when you are vomiting. No. We are saying that when she's vomiting, once in a while, be there and encourage her and let her know that she's okay, she's fine. She needs to keep some of the food for the baby. And pregnancy mood swings are taken seriously nowadays by health professionals. Yes, we've taken it serious. Research has been done. Findings are there to make us know that if mood swings are stopped early, mothers will never experience postpartum depression. The postpartum depression wouldn't graduate into depression. Previously, when the woman is pregnant, they will tell you it's normal. Nothing is normal. She needs that physical help. She needs that psychological help. And she needs that financial stability to go through the pregnancy. If she doesn't get all these things, the mood swings, when it comes in the third trimester, she's going to carry it all the way till the baby comes. And when the baby comes, we are going to handle something differently. That is postpartum depression. Then that postpartum depression will turn into something else. And we don't want that. We are saying that negative emotions that the woman goes through, that is the fear, the anxiety, the unexplained crying. These three things, fear, anxiety, unexplained crying, it's not normal. They are all part of mood swings, sorry. But when the partner is there, when the support base is high, why would she cry? She wouldn't cry. Why would she get scared? Because the husband is there to motivate. The husband is there to motivate. The husband is telling you, Charlie, I'm there with you. We're all going to push that day. There was a video I saw on social media. The man was, while the wife was pregnant, he has also stabbed the tummy. And they were all working together because the woman was due. She was in the 9th month. Contraction has started. The woman is almost getting into labor. And they were in the house. He was encouraging her. We are all going to push this baby out today. And I'm telling you, from the video I saw, from when the woman was pushing, the man was also holding the hand. They were all pushing together. And she was able to push 3 babies out, not 1, not 2, 3, within intervals. And all the babies are alive. And I've seen and I've experienced a water bath delivery of twins. And the man was so helpful from the journey the woman was pregnant all the way till birth. He was part of us in the bathtub whilst the woman was pushing. He was holding the woman, encouraging her, wiping the sweat, encouraging her to push. And the pushing was done. So with pregnancy nowadays, it's not about all is normal, it's for only women. No. Because now, the state women find themselves, it's not about 20 years ago, it's not about 30 years ago. Women are pregnant, they still go to work. They'll go and face challenges at work. They'll come home, they still become mothers, they still become wives at the same time. So we need the partners to be on their A game when the time comes. I'm still waiting for my questions. My questions are still not coming. I hope my questions will come because I have some few minutes to go. And all I can say is mood swings can be prevented. How can they be prevented? We need exercise. You need a lot of sleep. You need to take a break when you are tired. You need to also eat well. That's our 4-star diet. You need to also hydrate more. At the same time, also, you need to take a nap. When you are tired, sleep, rest. When you are working and you feel tired today, your break, when it's time for your break, just rest. At the same time, also, you need light exercise like what I did on the screen for you to see. At the same time, also, you need some girls' day out. You need to watch movies. You need to go out with friends. You need to have that relaxation, so that you know that pregnancy is not disease. Pregnancy is not isolation. Pregnancy means being proud of yourself, letting everybody know that you are happy that you are pregnant and proud mother to be, focusing on your journey, knowing that you have your partner who will support you physically, psychologically, and financially. You have your midwife who is there with you 24/7 when you call. You have a heavy family-based support who are there. And you have friends that you can chat with to ease the stress out. All these people come into place to make your journey lighter and smoother, and making sure that you become a happy mom with a happy baby, with a happy partner, and happy friends. Thank you so much for coming our way. This has been your only expert midwife. That is Midwife Ruby, coming your way this afternoon, sharing the little for us to know more and navigating our way all the way through mood swings to the labor ward. We love you and we say bye.